Good morning, everyone. So just waiting. Looks like Vicky's trying to get logged back in here. Can you guys hear me okay? I can't hear you. If anyone is talking. Okay, good. You can hear me. That's perfect. Yeah, Vicky's having a hard time getting logged in, so I'm gonna wait just a minute. And okay, just saw your comment, Jesse. Yes, let me get that registration link for you.
Hi, good morning. Sorry for that. I'm having horrible audio problems on my computer. This is Vicki Lau, Executive Director for the American Indian Health Commission. Can you hear me okay? Evan, can you hear me?
I can hear you, Vicki.
Okay. So, so you're at the Cascade Care Breakout session. Are we able to make Evan the presenter?
Yep, Evan is the presenter already. Well, he's a panelist, which there he is. Evan, do you want to share your screen, or would you like me to pull up your slides?
Oh, we can't hear him. Or I can't hear him.
I can't hear him. He is not muted. His microphone is green.
Can you hear me now?
Yes.
Yep.
We can hear
Okay,
you.
perfect. Yeah, I would love to share my screen if I'm able to. I don't see any buttons to do that though.
I can help with that.
Okay, thank you.
So I just want to thank Evan and the Washington Health Benefit Exchange for being a part of our summit and sharing this Cascade Care coverage information.
Okay, can you see the PowerPoint on my screen right now?
Oh, there it is. Yay.
Okay.
All right.
Perfect.
So Evan, if you want to introduce yourself, then go ahead. Thank you.
Yeah. And thank you for having me. Good morning, everyone. I'm Evan Klein. I'm a senior health policy analyst here at the Washington Health Benefit Exchange. And my focus, my portfolio is really around Cascade Care. So I'm happy to be with you this morning and chat with you a bit about this new program that we have in Washington. So I'm going to touch base on a couple things this morning. I'm really, I want to start off just with a very quick overview of the 2021 exchange market landscape, just to give you some background and context for the kind of the landscape in which Cascade Care is kind of kicking off in, and then going to focus predominantly on Cascade Care, what you'll see from the new plans that are going to be offered on the exchange this year, what that looks like on Health Plan Finder, and then I'm going to touch a little bit actually on the state subsidy study as well, which is a component of Cascade Care and the legislation that was passed a couple years ago. As I go through this, feel free to stop me for questions. I'm happy to take them as we go. I know that there's a chat box available to folks, or if I don't know if you're able to jump on via audio, but I do welcome questions throughout. So just a quick overview of the 2021 landscape. There's going to be 13 carriers offering on the exchange this year. This includes 4 new carriers, Community Health Network of Washington, Regions Blue Cross, and Regions Blue Cross Blue Shield of Oregon, so 2 carrier licenses, and then United Healthcare. We're really excited about the fact that all counties are going to have at least 2 carrier options in 2021. There were 8 counties that only had 1 option in 2020. And I believe this is the first time that the state has had 2+ carriers in every county of the state. So I'm excited about that. There are going to be around 115 total qualified health plans available on the exchange in 2021. So that is up pretty drastically from last year, and some counties will see between 69 and 70+ health plans available to customers in those counties, and that's up from a max of 35 QHPs available in any county last year. So a lot of plan offerings, which is great, for consumer choice, but also a lot more for folks to weed through when they're looking for plans and shopping right now during open enrollment. Cascade Care, obviously a big component of this, and we'll focus on that in the majority of this presentation. But there's kind of 2 components there. There's Cascade Care plans, which are standard plans, and they're available to customers in every county of the state. And then there's also public option plans, which are going to be offered by 5 carriers in 2021 and available in 19 counties. So. Another story here is premium decreases, which is, again, something we're excited about. It's good to see that that rates are on average going down across plans and across the state. Of course, that story isn't the same for every customer. You can see here on the right that while there's an average rate decrease of 2.4% from 2020 to 2021, it does vary between carriers and even more drastically between plans. So it's important for folks who are, might be coming on to shop for coverage or renewing their coverage in 2021 to understand kind of their specific circumstances. And another part of that story is tax credits. Whenever premiums change, there are implications for the federal tax credits that are available to customers. So those tax credits are benchmarked to the second lowest cost silver plan in their county. So the good news is, plan rates might be going down, but for some folks, that also means that their tax credit will go down. So, we have run an analysis, and there are around 40,000 exchange enrollees who, because of tax credit implications, may see a premium increase if they were to just renew into their same plan or the plan that they're mapped to in 2021. So again, just important to note that everyone's kind of individual circumstances may vary depending on where they're located and what coverage options are available to them. This is just a little bit more on the tax credit situation that I'm going to jump through. And as I noted, a little over 40,000 enrollees from 2020 who would be renewing into plans in 2021 who may see a premium increase because of some of these tax credit implications. So So now I'm going to jump into Cascade Care. So there are three main components of Cascade Care. This is, we refer to Cascade Care kind of as the piece of legislation, Senate Bill 5526 from 2019. And it included these three components that you see here on your screen. I'm going to kind of touch on them a little out of order with kind of a focus and highlight on number 2, which are standard qualified health plans. These plans underlie kind of the main components of Cascade Care. They're available statewide and something that we're very excited about. And then obviously, you know, maybe the most highly publicized kind of portion of the Cascade Care legislation is the public option. And so I'm also going to focus on the public option and then touch a little on the subsidy study here in a minute too. So just an overview for you of Cascade Care. So when I refer to Cascade plans, I'm referring to those standard plans. So kind of that bullet number 2 on the last slide. And when I refer to Cascade Select plans, that is talking about those public option plans. And we really kind of used that naming convention to highlight to folks that they really kind of are overlaying on top of each other. You know, we have a qualified health plan structure, so all the health plans on the exchange have to meet certain certification criteria and other criteria from the Affordable Care Act to be offered on the exchange. And then the standard plans kind of overlay on top of that, and then public option plans on top of that. So Cascade plans, those standard plans are available from every carrier and available in every county. So any carrier that's offering on the exchange has to offer those Cascade plans in 2021. Cascade Select, the public option program, is voluntary, but we did see 5 carriers offer Cascade Select plans for 2021. So something we're excited about. It's year 1 initial rollout, but some robust carrier participation. Most carriers are offering non-Cascade Care plans as well. So carriers are still permitted to offer non-standard plans on the market. And these would look like plans you would have seen in any other year with varying cost sharing designs and premiums. And consumers who were enrolled in 2020 or are still enrolled in 2020 are going to be auto-renewed into non-Cascade Care plans. So any of the plans that they're being renewed into are going to look very similar to the plans that they were in 2020, and they won't automatically jump into any of these standard plan structures. Certainly have the option to do so, and we're encouraging folks to come on and shop on the exchange to take a look at their plan options. But yeah. And this is just a look at what the Cascade Care logo looks like. And this is going to be used, or it's being used, I should say, on Health Plan Finder now that we're in open enrollment, to highlight when a plan is a Cascade Care plan. So all Cascade and Cascade Select plans will have this logo on the plan card. And that's to show customers who are coming on that, you know, if they see this, they know that they're getting that standard plan structure. And it's important to note too that these plans are only available on the exchange. So these plans are not being sold off exchange in the individual market. This graphic is really a highlight of the point that I made a little earlier, that these Cascade Care plans are really building on the existing structure of qualified health plans on the exchange. You know, all plans offered on the exchange, whether standard or non-standard, have to include the essential health benefits. They have to meet exchange certification criteria. They have to go through the regulatory review process at the Office of the Insurance Commissioner, and individuals who are purchasing those plans are eligible for the federal premium tax credits. And then standard plans really build on top of that. They include a set of standard cost shares and deductibles that were set by the Health Benefit Exchange in consultation with various stakeholders, including some of our agency partners. And they're designed to provide more value to customers. They provide lower deductibles, about $1,000 lower on average than the non-standard plans, but also more copays, so a little bit more transparency in what you're going to pay out of pocket for services. You're not reliant on as many co-insurance percentages, so you're not worried as much about provider reimbursement rates or things like that when you're thinking about how much you might owe for services on those designs. And that allows customers to shop by kind of a fewer variables. There's less at play when they're comparing between different Cascade Care plans. So you're really, if you're comparing two Cascade Care plans in the same metal tier, you're able to shop based on premium and network, as opposed to having to think about all of those other cost sharing components. And then the public option plans build on top of that as well. They are voluntary, as I noted. Carriers went through a procurement with the Washington Healthcare Authority, who developed contracts and some additional standards and requirements that these public option plans have to meet. They all utilize the standard plan design, but they overlay on top of that some additional requirements around value and quality, as well as provider reimbursement caps to in an attempt to kind of decrease the premiums and overall costs of those plans as well. So and this is just a highlight of the standard plan cost sharing design here on the right. As I noted, all of these standard plans are going to be marketed and sold as Cascade plans. All 13 carriers are offering them, and at each metal tier. So they're offered at the bronze, silver, and gold metal tier by every carrier. And so if a carrier is offering in the county in which you're located, they will be offering a bronze, silver, and gold Cascade plan. There are 51 total standard plans being offered statewide, with between 6 and 27 in any given county. And again, just trying to highlight the value of these plans. They ensure access to more services before the deductible. That includes preventative care, primary care, urgent care, mental and behavioral health services, which we know are incredibly important to folks, generic drugs. They include copays that provide a little bit more transparency and predictability for customers. So by having more copays than some of the non-standard plan structures in those same metal tiers, you as a customer have a better understanding of what you're going to pay out of pocket. Maximize the federal premium tax credit and establish a foundation for the public option plan. This is just to kind of highlight the point that they do provide, on average, $1,000 lower deductible than you would see from the average non-standard plan offered on the market. But they also, the standard plans are also affordable premiums. It varies depending on carrier and county, just as the non-standard plans tend to vary by premium. But we did see standard plans come out as the lowest silver premium in 8 counties. So there's some value provided there as well. And then, as I noted, the public option plans are being marketed and sold as Cascade Select plans, and these really overlay on top of that standard plan structure. So all of the public option plans utilize the standard benefit design, but in addition to that, they must meet some additional quality requirements and provider reimbursement requirements. And some of this was directed by the legislation that was passed in 2019. And some of the quality requirements, especially, were dictated through a procurement with the state that took place earlier, or I should say, earlier this year. There are 5 carriers that are offering a total of 15 public option plans on the exchange in 2021. And those plans will be available in 19 counties. So not available statewide, but for year one, we're kind of hopeful, about the number of carriers that opted to participate and the coverage around the state. And as you see here, those 5 carriers are Coordinated Care, Bridgespan, Community Health Network of Washington, United Healthcare, and LifeWise. This is just to give you a snapshot of where those plans are located. As you can see here on the right on this state map, all of the diamonds denote the counties in which a public option plan will be offered in 2021. And one other interesting note here, Community Health Network of Washington and United Healthcare are both new entrants to the Washington market in 2021. And both of them are only offering public option plans. So they opted only to offer those Cascade Select plans this year. So I also wanted to touch on the impact to American Indians and Alaska Natives. it's important to note, Cascade Care plans are available with all cost sharing reduction variants. And that includes the cost share plans for American Indian and Alaska Native customers. Members of federally recognized tribes are eligible. And AIN QHP enrollees with incomes under 300% of the federal poverty level who are eligible for advanced premium tax credits would still pay no cost sharing for services. And so that would include if they're enrolled in Cascade Care plans. All AIN QHP enrollees pay no cost share for any item or service furnished through an Indian care provider or through referral under contract health services as well. So it's kind of important to note here that if for AIN customers on the exchange, those who are earning under 300% of the federal poverty level, they are probably still going to end up enrolling in whatever plan is cheapest to them, the lowest premium available to them, because they're going to end up in a zero cost sharing variant plan anyways. And that may be a Cascade Care plan in some counties, it may not be in others. But for those customers who are over 300% of the federal poverty level or potentially ineligible for advanced premium tax credits, the Cascade Care plans do provide
Evan, it's showing that you're self-muted. Still can't hear you.
Okay, can you hear me now?
Yes.
Okay, it was, sorry, it was showing that I got muted by the organizer, but I swear I didn't touch anything.
I didn't touch anything
but apologies.
either.
apologies. Yeah, so I just to jump back into this, just wanted to note that for those AIN customers who are earning over 300% of the federal poverty level, or who may be ineligible for advanced premium tax credits, those individuals would certainly see value in the Cascade Care plan designs, and kind of a lot of those components that I previously touched on with the cost sharing designs and the lower deductibles of Cascade Care plans, would certainly be an option available to those customers. And then I just briefly wanted to touch on the state subsidy study. So this is the third component of the Cascade Care legislation, and is not being rolled out in 2021, but it is something that we were directed at the Health Benefit Exchange to study and analyze. The legislature directed us to develop a plan to implement and fund state premium subsidies, and we're really doing this analysis with a lens towards 2023, so plan year 2023, but going back to the legislature with a report at the end of this November, and then working with them during the next legislative session on state premium subsidies. The plan that we were directed to develop must include an assessment of the impact of subsidies on uninsured rate, an assessment of providing cost sharing reductions to plan participants, and implementing legislation. It was limited to individuals purchasing coverage on the exchange and those who are up to 500% of the federal poverty level. And there was an affordability goal that was part of the legislation, trying to limit participant premium spend to no more than 10% of income. And we kind of took that and developed some kind of key goals and considerations in consultation with various stakeholders to kind of lower the Washington uninsured rate, increase access, lower premiums, support continuity of coverage and retention. A component of that, the potential to zero out premiums for very low income individuals, those individuals who might be under 150% of the federal poverty level. and then build a credible and scalable model that we can utilize now and into the future to analyze the impact of subsidies. And as I noted, this is going to culminate in a report and implementation plan that we'll be delivering to the legislature by November 15th, so coming up here very shortly. And a lot of these materials are already available on our website, and we'll continue to make them available to folks. So if anyone does have any specific interest in what's kind of going on with the subsidy work, certainly keep an eye out for that report, which will be made available the middle of this month, but also a host of other materials that we've been working on and developing in part of this work throughout the summer. So something we're excited about, because again, the standard plans, the Cascade Care plans, create some value for customers through out-of-pocket reduction of out-of-pocket costs, or reduced deductibles and lower cost shares, and then through some of this additional affordability work with the state subsidy study, we're hoping that we can show that there's some additional value that the state can provide to customers on the exchange through reducing their premiums through premium subsidies.
Yeah. And, we have a question in the comment box here from Tony Lodge, and she was wondering, are 2020 FPL being used the whole year to evaluate 300% eligibility?
Our my understanding is that the eligibility will be determined based on your current plan year FPL. So for 2021, it would be your 2021 FPL. I believe James Manuel might be on the line and might be able to provide better detail, but I don't know if he can be unmuted.
Yeah, James said yes, and I'm going to go ahead and see if James, I unmuted you if you would like to speak.
Yeah, thanks so much, everyone. My name is James Manuel, Health Policy Analyst with the Exchange as well. Now, the FPL for the APTC is always a year behind. That's a rule in statute. So typically, the Apple Health FPL eligibility parameters are updated in April for that plan year, for the current plan year. And our requirement, because the federal tax credit is benchmarked off of the tax filing plan year, which typically, as we're all aware, you're filing for that plan year the year after the following year, right? So our FPL right now is for that reason, it's always it appears to be a year behind. So yes, the 300% FPL that takes us back for eligibility results beginning January will persist until the end of the year for APTC results.
Thank you, James.
Great, and I think that really wrapped up my presentation. Just a slide here, kind of the review of some of these programs we touched on, but I'm happy to take other questions if folks have them, or turn it back over.
If anyone has any questions, just let me know. I can make sure to turn on or unmute you. Or you can type them into the questions section and I can read them. Vicky, are you still on?
Yeah, apparently I double muted myself this time. Can you hear me okay?
Yeah, I know you're bouncing between meetings.
Yeah. Yes, thanks, Evan. Really appreciate you guys sharing this information. And then I keep thinking about how, this will be helpful in our tribal programs where the tribal income and the IRS filings don't always go well. So, even back in the basic health days, when we used to have the tax information in order for people to receive coverage. That has always been a complication. So I'm happy to see this moving forward. And I'm sorry, I did bounce back and forth. So I'm on the Universal Healthcare Work Group, and I know that we have looked at Cascade Care as maybe part of the path forward to universal healthcare. So I also want people to be thinking about that too. I know that right now, I think we have a couple more meetings with the Universal Healthcare Group, and then we'll send recommendations to the legislature. But there's like a 5-year plan to get to that in Washington State. So I don't know if there's any coordination going on with the Universal Healthcare Group very much, or expectations from the legislature about that.
Yeah, Vicki, that's a great point. I know that Joan Altman and Pam McEwen both attend and sit on the Universal Healthcare Work Group, and I know that there have been some conversations about, kind of how impacts of these two programs or work streams kind of overlay each other. I think the focus there has been around how our work on the state subsidy study kind of works with or overlays on top of some of the universal healthcare work. And we have done some work with that group to make sure that our actuarial analysis of that study aligns. So we're really working with the same numbers and the same understanding of the uninsured population and current costs of various programs in the state. So there's definitely been some dialogue there. I think we view the state subsidy study as kind of a potential component. It's a first step, it's an incremental step towards universal coverage and making sure that that coverage is affordable for customers. So yeah, and we'll see, obviously how the legislature views those two components or decides that they should be overlaid. We're still kind of working with them on that, but.
There's a question. Oh, Tony, can we unmute Tony out? Tony Joe? There you go. Tony.
Hi, can you hear me?
Yes, we can.
Oh, okay. Hi, this is Tony Joe from the Native Project. I just have a question about these new plans that are coming out, the new Cascade plans. Have the carriers been versed on the full cost sharing for AIHCs? Traditionally, we've had quite a bit of problems with new plans coming on board, and yes, their premiums are the lowest, and we pick their bronze plans, and then when it comes down to January and February and starting people using their plans, they're getting sent bills, and they shouldn't have any out of pocket if they're under the 300% of federal poverty level. So I was wondering about the accessibility to these new plans. Is there somebody that's assigned for AINs, like tribal assisters, to access them? So not going through the member services so much. It's traditionally been a real difficult thing when we're introducing new plans. And we are purchasing bronze plans for our members, for their members, and we have a hard time getting that cost sharing going. And usually the members' phones, if we call in on their call systems, they don't really understand what's going on, and they argue all the time. And I end up spending an hour on the phone with the member and I with the carrier. So my question is accessibility, I guess.
Yeah, and I'm going to again see if James Manuel might be available to.
Yeah, absolutely, Evan.
Great, thanks.
We got a question from Tony. It certainly escalated to us. So what I just want to confirm what I thought I heard, and then just to make sure I'm understanding the concern. So when we have new insurance companies that come in, when like a member or a patient calls the insurance company, the typical member services rep may be confused about the AIN cost sharing variance and give incorrect information or create confusion. And from an applicant's perspective, I guess my follow-up question is: are you also seeing that with like how your clinic is interacting with the insurance company from the claims and provider side, or is it from the applicant's perspective where they'll get an invoice for a provider and that sort of thing? I guess I asked that because I think it's a good point of seeing if our new insurance companies have an available resource to help specialize in these very nuanced tribal benefits. I don't know that we do have that, but that's something I can take back. Just want to help understand that I'm capturing that your concern, as well as if you've had any instances that we can follow up to escalate. I appreciate that as well. If you can get it over to Mary McHale and Deb Sosa, who's our navigator team, and we can escalate to the insurance companies. Is that typically what you get? Members call in the insurance company, and the insurance company is either giving them bad information or creating more confusion?
Yeah, that's exactly it. Or they're ending up with bills that are 60 days. We're moving into March. They were seen in January. Somehow that it's like a lab. It's not so much as a PCP, like if they're visiting us, but it's like their labs and their specialized cares. Typically those things, they tend to use the deductibles, which they don't have deductibles. And it's just the access to the service it's really crappy. Sorry, but it is. And it's that learning curve, that first 3 months. And it is really a severe problem because I dread February. Every time there's a new plan that's the lowest cost, life-wise, it is really hard. I end up sitting for an hour talking to member services with the member sitting with me because they're frustrated because now this is going to be sent to collections. And I'm just trying to jump ahead of this before this all starts, before I start signing up the first person in the plans.
No, no, absolutely. I'm glad you brought it up. It's not something that that has been visibility that I'm aware of, but certainly let's take it offline. And just to introduce myself, my name is James Manuel, policy analyst with the Exchange, and part of my portfolio is supporting these tribal issues in coordination with Deb, our tribal liaison, as well as Mary McHale, who's our associate director of outreach. So it's the first time I'm aware of that, but I do want to make sure that because we do have new carriers, that we, I guess, their staff, where they have the appropriate resources to serve, American Indians when they call. So I'll take not understand the concern. I'll take that offline and then circle back with you, Tony.
Great, thank you, James. And I'm sure I'll speak with Mary anyways, and I'm sure you guys can just get this addressed.
Things that I
and I see that A.B. Castillo from Community Health Plan Washington has his hand raised. A.B., if you can put your PIN in, it's 28722#. We can unmute you and you can ask your question. Otherwise, can you type it into the question box? Anybody else have a question while we're waiting?
Only one medical provider. If our medical provider goes out, we're going to be really hurting.
You can hear Marilyn in the background.
And the support for backup of providers might be needed to cover once the vaccine becomes available, being able to provide that service.
There's a question.
A lot of what we're talking about, but the tribal leaders prioritize that.
This is Tara. I'm having some audio problems. I can't hear anyone speaking besides Vicky.
Okay.
And Abby, Abby, I'm sorry. It looks like you have to enter a PIN if you would like to be unmuted.
So Jesse Dean said carriers should educate their network providers on AIN enrollees having no copays, and I think that's kind of what Tony was trying to get to. Tony says, haha, I can hear Marilyn. Now you can hear Steve probably. So, and I think James and are Mary and Michael still on. I think that was one of the things in the beginning that we really tried to do with those. Remember when we had the insurance carrier fairs and really tried to get that education to the insurance plans. A little bit harder to do now. Actually not, I lack of time, I guess. But it would be good to take maybe some of the materials we developed for the QHPs. Heather Erb developed really great guidance for QHPs working with Indian healthcare providers, and look at that and see if it's something we need to update and share with the Cascade care providers. Were we able to get AB unmuted? No. So AB, if you just type that PIN number into your phone and hit pound, we should be able to unmute you. Any other questions or comments? Tony said that was exactly what she was talking.
Okay, so we have a AB message in the comments and said, while Community Health Network is a new carrier, CHPW has been in the state since 1992. To Tony's question or concern, any issues, she can call Natalie Christofferson, Tribal Liaison, or me directly for assistance.
Sorry, was there an answer to that?
Okay, thank you, AB. And Tony Joe thanks you as well. And now we have a message from Natalie. This is Natalie with CHPW. We are one of the new carriers offering Cascade Select plan options. I, as the Tribal Liaison, have participated in all of the meetings and trainings from the WHBE, and am providing internal trainings for our staff.
Thank you. I'm happy to hear Community Health Plan of Washington is one of the plans, because I think I met AB on the phone back in the early 2000s when we were doing basic health, and Community Health Plan of Washington has always worked really well with the tribes. And so I appreciate that you guys are going to be one of the plans. Thank you. And Natalie's great to work with. We've done some education with them, and she's taken it and gone with it. So that's great news. Any other thoughts or questions? Did we get them all? Okay, well, if there is nothing else, Tony says we appreciate Community Health Plan of Washington too, and Natalie says thank you. So, just want to thank you guys for joining us this morning, and we'll give you back 12 minutes of your morning. Don't forget, we have other breakout sessions today. You can go to our website and click on the links and join them. There's some conversation rooms. There's one coming up on cultural resiliency that Cindy Gamble is going to be in, and on a workforce. And I think I'm going to be in that one. And we're just trying to offer some spaces to have conversations, because we know when we have these in-person summits, some of the most important work that gets done isn't listening to the presentations or they're actually the things that happen in the hallway or by the coffee pot or during dinner, where we get to talk about thoughts that we've been having and want to connect with other people and see what they're doing and know what they're thinking. So I hope you can join us in some of those other sessions. And thanks again to Evan and the Exchange for joining us this morning and sharing this great information. And thank you, AB and Natalie from Community Health Plan in Washington for being a part of this coverage, because I think that will be helpful. I hope you guys are statewide. And thanks to all the rest of you for joining. So now I've taken up 2 minutes, so you get 10 minutes back for your day. Thank you. Have a great day.
Thanks, Vicki. Thanks all. Take care.
Thank you.